What an awesome day. What an awesome day. Your being human is your personal journey from bravery into action, united. I'm here to help you get there. We have a global health crisis. It's staggering when you think about it, but the majority of people in the world actually are in some form of ill health. There are staggering inequities and disparities of health across the globe. We, in addition, because of wars and occupations and natural disasters, have millions and millions of people whose health is on a tipping point towards disaster. Follow me on this journey as we begin to think about how we can bring and restore health to the world. I want to tell you a little bit about my personal journey into this area of global health. When I was 14 years old, I had a unique opportunity to go to Mexico for a language immersion course. And on the ride from the airport to Mexico City, I had what was to be my first experience of post-traumatic stress disorder. Mile after mile after mile of poverty, inequality, social injustice, economic injustice, and health injustice. The barrios. It left me staggered and stunned. In fact, to this day, that historical moment to where I stand today has never left me and continues to drive me every single day. We have a crisis. One way to think about the crisis is a very simple fact that a child born in Swaziland is 30 times more likely to die before the age of 5 than a child born in Sweden. That's staggering. I know here, when we speak about global health issues in the United States, by the way, we tend to look at it through somewhat narrow eyes. We tend to think of the global health problems being over there. But actually, it's in our backyard. This is a picture of a neighborhood in San Francisco called Bayview Hunters Point. San Francisco is one of the wealthiest cities in the planet with some of the best healthcare infrastructure. And yet in Bayview Hunters Point, when children go to school, in kindergarten, larger and larger numbers of individuals have what I call the quadruple threat: diabetes, hypertension, obesity, and depression. That's in our backyard. Health and wellness are absolute and fundamental human rights. They are not privileges. We have an obligation to engage and act with communities and people to confront this crisis. Every human being absolutely deserves good health. But this crisis that I'm speaking about is probably not what you think. There's actually a new reality of global health and a new reality of our global health crisis. And what it has to do is the increasing burden of chronic illness, or what we sometimes refer to as non-communicable diseases. And if you look at 2002, for example, when you look at the burden of both communicable and non-communicable diseases, they're about evenly matched, 44%. But if you project into the future, infectious disease is going to decrease in terms of its burden, and what we're headed to see is a very dramatic increase in the burden of chronic illnesses. And this is the burden and the new health reality in our global crisis. In fact, if you look at the leading causes of mortality in the world today, it's actually chronic illness is responsible for over 63% of the deaths in the world today. And we still have 7.5 million children who die each year from preventable diseases. You know, one of the things we're trying to work with you on today is united in action. When you see these things and you hear these stories, It should unite us in a form of action. Okay, let's talk about what the major burdens of chronic illness are. Well, the first two should be pretty obvious. It's cardiovascular disease and diabetes. But what shocked me in terms of the research that I've been doing and the area that I specialize in is this profound thing called mental illness, specifically depression, anxiety, and post-traumatic stress disorder, which in fact is the third greatest burden on chronic illness in the world. And then if you look at the risk factors that contribute to the development of chronic illness, these are all the things. A lot of alcohol use, high blood sugar, physical inactivity, obesity, smoking, poor diet. Now, what is striking about this list? There's something really striking about it, at least me when I saw it for the first time. That most of these, if not all, are directly affected by, if not caused by, behavior and lifestyle changes. Which means that changes in behavior and lifestyle can actually exact profound impacts on one's overall health. Small changes in behavior can produce dramatic and large effects on your health. Think about it. Small changes in behavior can produce massive and positive change in one's individual health. When you think about 80% of heart disease, diabetes, and other chronic illnesses can be prevented, managed, or controlled through behavior change, it has to give us pause for thought. It did, for me, it was shattering to look at this. Especially because I work at a traditional medical center, and I realize that our infrastructure, our training, our intervention models, every way we train new doctors and new health providers in no way prepares us for this global health crisis. It's really geared to the reality of infectious disease. If we're truly committed to this, we have to rethink and reformulate a way in which we can connect and engage with large communities and scale. Okay. We've started a new field of inquiry. This new field of inquiry is the intersection among three different distinct areas in medicine: behavioral medicine, health psychology, and global mental health. And what we call it is global health psychology. Global health psychology deals with this tremendous resource problem we have, where there are not enough physicians or health providers in the world to really address the problems that we have. How are we going to close the gap? This Western model we have of one physician with one patient. What are we going to do? Global health psychology is one way to think about how we're going to close that gap. It's a new field, and it's an approach to train health facilitators and enhancers, people who are going to enhance health and wellness with a multiplier effect. I love to tell this story about the multiplier effect. So I'm going to the Gaza Strip for the first time. This was some 23 years ago. And I got invited by the Minister of Health at the time to address and talk about some of the mental health issues that Palestinian children were experiencing in the Gaza Strip. Even at that time, 23 years ago, about 80% of Palestinian children in the Gaza Strip had at least one symptom of post-traumatic stress disorder. That's unimaginable. So I asked to be taken to the community or to the professional center of psychologists, psychiatrists, I said, get together all of the mental health professionals, and we're going to sit down and we're going to map this out. So they dutifully drove me, and we're going through different alleys, and we get to this office, and there's one person in it. And I say, okay, well, it's very nice to meet you, but where is everybody? He says, you're looking at it. One psychiatrist for 1.5 million people. 1 psychiatrist for 1.5 million people. Now, I'd come from San Francisco. I could not wrap my mind around that. See, in San Francisco, we have 5 psychiatrists for every 10 people. So the idea of like one, yeah, it's true. It's true in Manhattan too. But the idea of 1 psychiatrist for 1.5 million people, I just could not wrap my mind around. So we came up with this idea. The idea was we're going to develop a community mental health training program where we would train physicians, nurses, social workers, and community activists on the basic principles of community mental health. And I'm delighted to tell you that in less than 15 years, we trained so many community mental health activists that now, after 15 plus years, we can reach those 1.5 million people in the Gaza Strip. Do you really think a one-on-one model is going to work in developing countries with such staggering difficulties? There are 2 million Syrian refugees right now languishing in refugee camps. The idea of this one-on-one model is just not going to work. So we now have to train a legion of global health psychologists and facilitators to reach out, to connect, to engage, and empower communities and what I call the other natural occurring collectives of people, slums, refugee camps, wherever natural occurring communities are, that's where we want to intervene. I want to talk very briefly, though, just about the principles of global health psychology to get you all to just think outside your normal parameters of how to think about delivering healthcare. There's a few that I would just want to focus on. One in particular that I like to talk about is D, which is culturally and linguistically nuanced and informed programs. What does that mean? The first time I went to Gaza Strip, I said, okay, let's talk about how many people are depressed. Well, at that time, there wasn't even a word for depression in Arabic. So people were looking at me like, what's that? So the idea of somehow transposing what you have here in terms of Western models somewhere else, there has to be culturally and linguistically nuanced and informed strategies. There's also the power of mobile tech. We did this really great study and pilot study in some of the refugee camps in the West Bank, and we found that diabetes was so out of control and people were not able to get connected to any kind of healthcare around diabetes. We started using mobile technology to connect with people and get them interested in their bodies. Ultimately, the challenge for all of us who are healthcare providers is getting other people interested in taking care of themselves. Not to give them pills, but to empower them to be interested and take care of themselves. That's the power. That's the power of global health psychology. Global health, and I'm glad to be saying this at the United Nations, global health is a fundamental human right that benefits all. We've worked from the slums of Mumbai all the way to the refugee camps in the Gaza Strip and beyond. And I'm here today to tell you that this process is unfolding at such a rapid rate that we need people to get on board. The 2 million Syrian refugees who are languishing right now, who are on the tipping point of such ill health, is worrisome, but it is just the tip of the iceberg. I'm going to end today by telling you just about 3 children. This picture I took when I was in the Gaza Strip in one of my darkest moments, when bombs were dropping, families were being killed. It makes me think of 3 children. First is Ahmed, who is an 8-year-old Palestinian child who had to bear witness to his entire family being killed. From that time, with courage and dignity and without charity, he continues to go to school to make a better life for himself. I think of Aisha, a a 13-year-old Syrian girl in Zaatari camp who cries herself to bed every night because she so desperately misses her father. And then I think of Tanya, a 13-year-old girl at Bayview Hunters Point who has diabetes, hypertension, and high cholesterol and depression, who with dignity and self-respect gets herself to school every day. My question to you, these children, united in action, are brave. My question to you, are you ready to be brave and united in action for global health? Thank you.